Today we're welcoming Dr. Kevin Smith to the show today. This is very important information to get out there as we're talking about. And, the health and wellness landscape, I believe, is changing for the better. And it's people like this, it's platforms like this, just getting information out there as best as we can. And as I like to say, knowledge is not power. Knowledge applied is power and wisdom. Very excited to have you on the show today. How you doing, man?
I'm very well. Thank you for having me. It's a pleasure to
Absolutely.
be here.
So I'm very curious to hear your story and how you got into functional medicine. Did you have your own health story that you'd overcome? Like, how did you get into this?
Okay, so it's a great question. My base degree is I'm a doctor of chiropractic, and I'm also a board certified clinical nutritionist as well as a functional medicine practitioner. I've been practicing functional medicine for about 25 years, and I'm the author of two books. I'm a public speaker, and I enjoy teaching others about things that they can do to optimize their health and their lifestyle.
Very good, man. So it sounds like you got into the wellness place and you really want to be of service, right? Because you're not just everyone is going to write a book, not everyone is going to do public speaking. So that's I'm very curious. Like, what was kind of the spark that really kind of set you on your trail to want to be of service and help people the way that you are?
Well, when I first went into practice, I graduated from school back in 2001. And when I got out, I was trying to help people using the skills that I was taught in school. And I was doing pretty well. The word got around and my practice was growing. And every once in a while, people would come in with some kind of a problem that I did not have the skills to figure out what was wrong with him. Couldn't help him. I had no idea what to do about it. People would come in with thyroid problems, or they had menopausal issues, or they were having problems with blood sugar issues like diabetes or insulin resistance, and I had no idea what to do about it. So I sat down to start taking seminars and learn as much as I possibly could. And so that has taken a long time to try to accumulate that knowledge and that skill set to try to figure out what to do about this. And over the course of years or decades, I started to notice some trends. I started to notice that there are certain things that I should do to mostly everybody to clean them up metabolically. Like, for example, if a person eats at McDonald's 6 times a week, they're not gonna be healthy. You can't eat fast
Right.
food that many times and still expect to have a good outcome. If a person has a history of insulin resistance and type 2 diabetes, that has to be addressed. You just can't ignore it. And I found that there's a lot of commonality that I'm seeing with patients. A lot of people have the same issues, and I'm seeing that over and over again. And so I sat down to try to create some kind of a standard of care, some kind of a metric that I could use. And so that's how I got my start with this. And I started to be able to help more and more people. And again, word got around, and here I am.
Very good, man. So it sounds like you done a lot of study yourself and you kind of come up with your own method of helping people, it sounds. And I respect that a lot because, you know, just learning a lot of health information myself, it does take a lot of effort. So I commend you on that. And then not only like helping yourself, but being of service, that's key, man. So I really appreciate that. Can you explain to the audience what is functional medicine and how can people get benefit out of it?
Okay, well, that's a great question, too. There's two broad categories of medicine in America. There is traditional medicine, or allopathic medicine, as the proper word is, and that is what medical doctors mostly practice. And the purpose of traditional medicine is to try to suppress symptoms, try to go after symptoms by using drugs. So, for example, if the person has um, high cholesterol, they will put them on a statin drug. If the person has, they don't want to get pregnant, they'll put them on birth control medications. If they have a problem with muscle spasms, they'll give them a muscle relaxant to try to calm that down. So no matter what the problem presents itself with, there's a drug for it. And I'm sure we've all seen drug ads on TV. They're all the time, no matter what channel you watch, no matter what time of the day, no matter what network you're viewing, there are drug ads. And so we're seeing talk to your doctor to see if blankety blank drug is right for you type of ads. And currently, the United States and New Zealand are the only two countries in the world where drug ads are allowed. You're
Wow.
never going to see a drug ad in Canada. You're never going to see a drug ad in Mexico or Germany or Japan. They're just not allowed. In 1997, the FDA allowed direct-to-consumer marketing to occur in the United States. And it just so happens that the United States and New Zealand have the highest cost per capita of healthcare. Go
Really?
figure. Now, contrast that with functional medicine. Functional medicine is the other side of the fence. Functional medicine is not interested in chasing symptoms using drugs. The purpose of functional medicine is to ask the question, why? Why is this occurring? Medical doctors don't ask that question. They don't care. So when you go to see your primary care physician and you have certain symptoms, you're put in a specific diagnostic box. And if you're in that diagnostic box, these are the drugs that are recommended. That's what you're going to get. Functional medicine, on the other hand, is looking for the root cause of the problem, of the root cause of the issue. So, for example, if you have, say, high cholesterol, well, why do you have high cholesterol? What is going on in your liver? What's going on in your vascular system that's causing your cholesterol levels to rise? If you have high blood pressure, why do you have high blood pressure? And so it seeks to look at the root cause of the problem, not just superficially chase down the symptoms. Now, the other part of this is that most people in this country are currently in the allopathic sector. They go to see the medical doctors. And when you go to see your primary care doctor, the doctor is going to give you about 7 minutes of face-to-face time, and then he's going to kick you out the door. It's a very high-speed system. They don't really dig too deep, and they don't really figure out what's going on with you. The doctors also order about this much testing in order to come up with a diagnosis, in order to prescribe a drug. In other words, he's going to do exactly whatever the insurance company dictates to him that they will pay for, because they're probably sick and tired of fighting with insurance companies. So by the time you even walk in the guy's door, your treatment plan has already been predetermined by the insurance company. That's it. The insurance company is in the driver's seat, not the doctors. And so the insurance company takes their orders from an actuary that sits in a cubicle in Chicago or New York City that has never met you, has never read your chart, has never looked at your labs, has never done an exam, but they are going to determine what treatment plan that you're going to get. And some of the buzzwords that they use is evidence-based. And so that's just an insurance buzzword. The functional medicine doctor is not going to order this much test. He's going to order this much testing to look at the entire metabolic landscape to see where some connections may occur that can be the root cause of what's going on with you. As an example, when I treat thyroid problems, I look at a lot of different things, like, for example, autoimmunity. Most medical doctors don't look at that. They don't appreciate the fact that there's a relationship that exists between your body's immune system and your thyroid gland. And so According to the literature, according to the Academy of Endocrinology, 90% of everybody that has low thyroid disease has an autoimmune condition called Hashimoto's disease. That's not everybody, but it's almost everybody. And so, what we want to do is to find out what's going on with the immune system, and could it be contributory to the what's going on with the thyroid. The second part of that is that there are a bunch of different triggers that can disrupt thyroid function peripherally. And so some of these things include anemias. They can include blood sugar problems, like type 2 diabetes or insulin resistance. It can include stress hormones called cortisol. It can involve the sex hormones, estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to be in the right amount, and they have to be balanced for their gender and for their age. It can involve chronic inflammation and oxidative stress. It can involve things like like food allergies. Like if you eat something on Monday and on Thursday you get a headache, and you're like, "What did I do? What could be the cause of this?" We have labs that can determine exactly what's going on with that. It can involve things like chemical sensitivities that could be due to household cleaners or solvents if you work in a foundry or a factory. It can involve stealth infections like Epstein-Barr virus, cytomegalovirus, herpes viruses. All these things can cause disruption of the thyroid gland itself. And the medical doctors don't appreciate that. They don't test for it. They don't ask questions about it. And subsequently, people never get relief from their problem if they're just going to simply go to the primary care physician and then take a pill like Synthroid and expect that to work for them. It's not going to happen. This type of thing has been going on since 1965, and it hasn't changed. The names of the drugs have changed. The names of the tests have changed a little bit, but the methods don't really change that much at all because of the way that our society is.
Absolutely, man. Thank you for sharing that. It was a lot of good points there. Uh, kind of laid it all out there, and a couple things stuck out. So, out of curiosity, do you know how much we spent on healthcare as of last year?
$4.3 trillion dollars.
Wow. Yeah, because I
Now,
knew it was around that. I thought it was raised a little bit. I guess I heard different things, but
They
from what I
they
understand,
the Centers of Medicare and Medicaid publish studies about once a year about the total expenditure. That was 2024 numbers. It could be recalculated for 2025, but we have to wait till next year to find those out. But the thing that's significant about that is that that is more money than the next 20 countries combined. We spend so much money on healthcare. And the thing that's interesting is that when it comes to medical doctors that are trained in the United States are the very best in the entire world at diagnosing and treating acute problems or problems that require a heroic measure to save a life. Like, for example, a heart attack or a stroke or a gunshot wound or a burn or something like that. They're phenomenal. So if I'm having a heart attack, I am not going to go to a chiropractor. I'm going to go straight to the emergency department and plug me into whatever you got. Now the thing is, we spend 90 cents of every dollar treating chronic problems, not acute problems. So 90 cents of every dollar is spent to treat things like high blood pressure or thyroid disease or glaucoma or some kind of a brain disorder like multiple sclerosis. And medical doctors are horrible at treating chronic problems. And it's not my opinion, it's what's in the medical literature. They do not actually cure chronic conditions. With one exception, I can think of one drug, an antibiotic that has the potential to clear out a bacterial infection. I cannot think of any single other health problem that has been cured by drugs, not one. And they spend, of that $4.3 trillion, 90 cents of every $1 treating chronic problems. And that's where the problem is.
Absolutely, man. Like you kind of mentioned, it's all about treating the symptoms, right? We don't really get to the root of the issue. And
Right.
to my understanding, like we spend like the most by far, but aren't we ranked like number 38 in terms of health outcomes?
That's correct. That's absolutely true. The country that's right below us is Costa Rica, a third world country. And so we in terms of overall health, that is calculated by scientists. They check the morbidity and mortality, and we're ranked very, very low in the list. I think France is number one, which is odd because they smoke like chimneys and they put fatty sauces on everything. But what they don't do is they don't go to McDonald's all the time. They walk to the market, they buy fresh ingredients, they slowly chew their food. They don't rush home from work to take Billy to baseball practice and go through a drive-through somewhere. And their lifestyle is very, very different. And number two is the Japanese. The Japanese have the second best health in the world. The United States is like 38th.
Yeah. Incredible, man. I mean, it's definitely something that we work on changing every day, right? It's like the more information that we get out there, the more self-empowerment that we take. I mean, that's the mission. So I understand you talk a lot about autoimmune diseases. Can you define what an autoimmune disease is and
Sure.
perhaps
The
some triggers as well?
Sure. The immune system is your white blood cells that circulate throughout your body, and they are your body's defense system. So when you have a bacteria or a virus or a parasite or some other kind of critter that shouldn't be in your body, the white blood cells protect you. It goes in there and they gobble them up. Now, what happens with autoimmune disease is that that system that's supposed to be protecting you accidentally turns on the body and starts attacking your own body. And if you ever, for people that have this, you don't really appreciate your body's immune system until it turns against you. There's a couple things I want to mention about this. First of all, autoimmune disease cannot be cured. Any doctor that tells you that they have a cure for autoimmune problems is lying to you. Now, you can't flip a switch and turn it off like you can a light switch, but you can dim it down like you can turn down the electricity to the chandelier over your dining room table and put it into remission so it's no longer causing mischief. And that's the best hope that people have for this. Now, what causes autoimmune disease is a mystery. Nobody knows exactly what the cause is. Some scientists have thought maybe it's genetic. It's passed down from father to son. Other people feel that it's environmental by the breathing the air, drinking the water, eating the food, things like that. You ingest so much stuff, and then all of a sudden it just goes off on you. Other people have come up with ideas that it's related to some kind of a life event, such as the death of an important person in your life, or a marriage, or the birth of a child. A lot of people tell me that their problems started shortly after they gave birth to their second kid, or after they had a big move. Moving is very, very, very stressful. So some kind of a life event a lot of times precipitates this thing that happens. Now, autoimmune disease is kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids over there too. So it's very common to see an immune attack on, say, the thyroid gland, and also the brain and the skin and the GI system, all kinds of things. So it's a very, very common to see multiple areas of involvement, more so than just a single thing. Some of the stuff that can trigger autoimmune disease is problems that are in the gut. So, and the body's gut, what I mean by that is the small intestine and the large intestine. There's a problem called leaky gut syndrome that can cause this problem to get worse. And what that means is that imagine food passing through a tube, and the tube has holes where the food passes right through the holes and can go directly into the bloodstream, as opposed to being processed normally. And so when the food particles get passed directly into the bloodstream, the body doesn't know what it is. And so it tries to protect it. It says, I don't know what you are. I think you're an invader. I'm going to attack you. And that sends the macrophages, the lymphocytes, the eosinophils to the area, and so they start attacking the food particles, thinking it's an invader. It's like some kind of a bacteria. And that's what sets off autoimmune disease. So when you have leaky gut syndrome, you're also going to have a leaky brain, a porous blood-brain barrier system, and that can cause things like brain fog. It can cause depression, anxiety. It can cause nervousness, irritability, some kind of a problem with memory, all kinds of stuff. And then the current literature also talks about leaky lungs, so it can affect the respiratory system. So when you have a problem with your gut, you can have a problem with your brain and your lungs, and it can just spiral completely out of control. The current literature says that the body's gut is your second brain. And so when you're having a problem with your gut, it's going to also manifest as problems in the brain as well. And that can affect cognition, it can affect mood, it can affect memory, higher executive functions, just literally all kinds of stuff. And so that's the gut is the area of the body where your body's neurotransmitters, many of them are peripherally manufactured, such as serotonin and dopamine. And so if you don't have enough serotonin and dopamine, you need to look at the source of the problem, which is in the gut, and see if there's anything wrong with there. So whenever somebody comes into my office and they have a brain issue, the first thing I do is I look at the gut and find out what's going on and what can we do to fix that.
Absolutely. Thank you for sharing that, man. That's great information there. So when it comes to leaky gut, can you define what causes that in the first place?
I've heard different things from different people. One of the things that causes leaky gut is gluten. And so gluten, what it is, that's like glue that holds a protein molecule and wheat products very closely together. And the food manufacturers, they intentionally mess around with the stuff to make cupcakes fluffier and bread softer, and they do things to try to make things more palatable so you'll buy it more. They don't care about your health. There was just a recent argument in Washington, D.C. when RFK Jr. wanted to take certain dyes out of food products, and he was met with massive resistance from these manufacturers. Like, how dare you tell me to take red number 40 out of my product, right? And probably not the best thing to put into a growing body. But how it relates to autoimmune disease is that the gluten causes the food particles to go directly into the bloodstream. So if you have a food particle and it doesn't break down normally and naturally, and it goes directly into the bloodstream as a 2-particle item, that's called a dipeptide. If it's 3 particles together, that's called a tripeptide. And 5 would be a quintpeptide, and so on and so forth. And so you're not able to break down proteins normally, and that causes destruction of the lining of the gut wall, and that causes a problem with autoimmune disease and all the other things attached to it, as I said before.
Awesome. So, to my understanding, stress and infections are also contributors. Is that right?
Yeah, there's three types of stress that we all face, all of us. There's physical stress, there's chemical stress, and there's emotional stress. And so the body doesn't really differentiate. They just say this is stress. And so it starts to work on the stress organs of the body, primarily the adrenal glands, to produce a stress hormone called cortisol. And that has an effect on your body's gut. It has effect on leaky gut syndrome, and everything ties together that way. So that's why it's very, very important that people manage their stress. Meditation, exercise, whatever your thing is, that's fine, just as long as your cortisol is kept in the right amounts so it cannot cause these problems.
Got it. And so, if people have an autoimmune disease and leaky gut, what are some things that we can do to start to heal up the gut? Is it nutrition based? Is it certain things that we can ingest? How do we start to do that?
My preference is to address these problems first and foremost through lifestyle modification. So it would be dietary modifications. It would be going gluten free and any other kind of chemical trigger that is located in your food that can disrupt this. There's certain supplements like L-glutamine, that's an amino acid that heals the lining of the gut. Also aloe vera and diglycerated licorice extract. All those, they're all there to calm things down, to remove spasm in the gut wall, to heal the lining of the gut, and make sure that whatever you're eating, breakfast, lunch, and dinner, it's being passed correctly, it's being absorbed into your body correctly, and you're not leaving the potential for autoimmune, an exacerbation of your immune system.
Got it. Thanks for sharing that. You mentioned earlier when it comes to the thyroid, it's mostly people with Hashimoto's. Do I have that correct?
Yeah, that's correct. So 90% of everybody that has low thyroid problems called hypothyroidism has an autoimmune disease called Hashimoto's disease. Now, that's not everybody, but it's almost everybody. It's about 90% of the people that have this. People that have thyroid problems, they typically have weight gain, they have low energy. They cannot lose weight even with diet and exercise. Their hair may fall out in clumps in the sink. They may have weak or cracked or brittle nails on their fingers or their toes. They may be missing the outer 1/3 of the eyebrow. They may have constipation or diarrhea. They may have brain fog or some kind of irritability issues. They may have infertility if it's a childbearing woman of a certain childbearing years and she's trying to get pregnant. If she has Hashimoto's, it's going to be really, really hard to do that. And like I said, with autoimmune disease, you can't cure it. There's no shutoff switch, but you can dim it down by doing certain things to put it into remission. And that's really the best hope that people have.
Got it. That makes sense. To my understanding, in the medical system, we had the testing all wrong. Like we basically test for nothing, pretty much, just TSH. And to understand the problem, you need to go further into testing, which is what functional medicine is great at. Do I have that right?
That's correct. So there's two things. So first of all, the medical establishment orders too few tests, and they don't see the whole metabolic landscape. They only have a very, very small picture of the pie, and they just assume the rest of the information. The rest of it has to do with what kind of metrics, what kind of standards are you holding to these tests. So when you go to a traditional lab like Quest Diagnostics or LabCorp, they are going to have a published reference interval, and the reference interval is going to have a low number and a high number. And so if your number is between those two, you're okay, right? Those numbers are different based on which lab that you look at. Quest Diagnostics has different numbers, as does LabCorp. And they're also based on geography. So people in, say, Detroit are going to be different from people in Pittsburgh. They're going to be different from people in Orlando. They're going to be different from people in Las Vegas. Those are the statistical averages of everybody that goes to the hospital. And so they compute the average score. It's like the average body temperature is 98.6, right? How do we know that? It's based on calculating it from millions and millions of people. That's the average score for millions of people. So they have this reference interval that's differs based on where you get it taken, which lab you go to. So what functional medicine does is we look at this from a couple of different standpoints. There's in the middle of the score is the functional level, the functional normal. And the functional normal is the sweet spot. That's where you should be. That's not the lab normal, that's the functional normal. It's a very tight, unforgiving, tight tolerance, but that's normal. That's compared to healthy people. The lab normal, which is the reference interval, is based on a sick patient population. The functional normal is based on a healthy patient population. So who would you rather be compared to, sick people or healthy people?
Healthy people.
Exactly, all day long. So I send people to the lab, and I get their information back. And what I do is I say, this is the functional normal, this range right here. This is the other range, the functional normal, and this is their score. So if their score is in the functional range, I color code that as green. And if it's outside of the functional range, but it's still within the lab range, I color code that as yellow. And if it's outside the lab range, I color code that as red. So what this means is if it color codes it as green, if they're within the functional range, that's perfect. They don't need to do anything with that. That's exactly where they should be. If they color code that as yellow, they're outside the functional range, but they're still within the lab range. That means that they're moving in the wrong direction. So we need to see what's going on with that. And then if they're outside the lab range, I color code that as red. That means that they're already in full-blown pathology, and we need to address that right away. By using the system, I can figure out what's going on with a person long before the medical doctor can, because he's only going by the lab ranges. He's only going by that. He's not looking at the functional ranges or what's outside the functional ranges. And so they're not ordering enough tests, and they're not using the right types of metrics to gather information about what's going on with that. And that really is the major difference between what I do versus what a medical doctor does, traditional medicine versus functional medicine.
Got it. So it sounds like we don't just want things in the normal range, but the optimal range to actually feel healthy and live our own vibrant state of health. Is that right?
That's correct. That's right.
Got it. So when it comes to health insurance, which is another thing that I know you talk about, are there certain things that we need to be aware of? Because I understand that most holistic therapies, like functional medicine and things like that, they're not covered. Do you want to get into that a little bit?
Well, I would say that if people are only interested in keeping their chronic health problems, just make sure you do anything that's covered by your insurance. Insurance was never designed to cure a problem. It was designed for catastrophic issues. So, for example, if you are in a car accident and you need to be taken to the hospital via ambulance and you need a lot of attention right there, that's what insurance is for. It is not for uh, daily visits to the doctor. It was never designed for that. And so it's just gotten so out of control. Where I'm at in Pittsburgh, the insurance is getting so bad, they don't pay for much of anything. And they have a huge deductible and they have a huge co-payment. And it's a racket. It really is.
Yeah, I mean, why do you think that the insurance industry doesn't really um, recognize these things as people can use them to be healthy, right? Because a lot of us we kind of avoid holistic things because it's not covered by insurance, which is kind of a sad thing.
Well, that's the $1 million question. Um, I, I, I'm pretty much sure that the people that run the companies will go to a functional medicine doctor. But for their customers, I mean, insurance companies don't really care about you. They don't care about your health. They're not responsible to you. They are responsible to their shareholders. They're responsible to make a profit. And so they have to say, I need to pull in more money than money is going out. And that's one of the reasons why we cannot, we don't want to invest in this. Another thing is that a customer cured is a customer lost. So medical doctors and insurance companies, they have no interest in finding out a cure for something. They just want to keep stringing people along indefinitely. So if a person has thyroid disease, they're going to be given Synthroid or levothyroxine for the rest of their life. If I ask people, what would happen to you if you stopped taking your medications tomorrow? They said, well, the symptoms would come back. Well, that means that they haven't really cured you, has it? And they start to understand it. I'm not interested in suppressing symptoms. I'm interested in correcting the problem.
Absolutely, that makes sense. Thanks for sharing that. So I know you also talk about weight loss as well, which is obviously a huge issue in America. And to my understanding, about three-quarters of the population are either overweight or obese. So the stats are kind of like insane in a sense. What is your approach to weight loss, and how do we start to kind of approach it differently as well? Meaning, like a lot of people were just focused on weight instead of focusing on health. And what I find is that when we focus on health, the weight tends to fall off. Do I have that right?
In a lot of respects, you do. I think it's a very, very complicated subject, and it involves what you're eating. It involves psychology. I think that 95% of weight loss is psychological. And so a lot of people don't really think of that like that. They think, oh, it's just a matter of not eating fried foods or not eating white foods like bread and pasta and rice and things like that. There's a lot of wisdom in that too. But I think that ultimately it comes down to lifestyle modification. It comes down to portion control. It comes down to eating the right types of foods at the right time. Um, One of the things about that's kind of ties back in with what we said before is that there's a lot of mythology out there in healthcare. There's a lot of just incorrect information being passed along. Back in the 1970s, they thought that it was all about low fat. You want to go low fat, high carb, and they used to have a thing. The USDA had a food pyramid, and the food pyramid was supposed to teach us and educate us about the foods that we eat, and that the base of that pyramid, the bottom part, was the part that you should eat the most of, and that was cereals and grains and things like that. And after a while, they're like, boy, that's causing a lot of disease. Maybe we have to rethink this model. And things like skim milk came out of that. And I talk to people when they come to see me, and they say, well, I have diabetes. And I'm like, okay, what did your primary care do for you? Well, the doctor sent me to a nutritionist. Okay, and what did the nutritionist tell you to do? Well, they want me to eat Honey Nut Cheerios and skim milk for breakfast. I'm like, okay, yeah. It, it,
Oh man.
it's like trying to unlearn a whole bunch of nonsense that's been drilled into people's heads for decades and decades and decades. And that is really, really, really hard when you're dealing with lifestyle, you're dealing with a lifetime of bad eating habits and poor choices. It's very difficult to change people's habits. Very hard.
Absolutely. To my understanding, like the education that most nutritionists get is funded by processed food companies like I can't believe it's not butter, Coke, General Mills. And like I talked about recently, like if you want to become a health coach, like it's you really need to go to these alternative certifications like ITN or IIN, right? And also become a lifelong learner, like constantly read, constantly listen to podcasts, things like that, just to up level your craft and be of service. That's kind of what I do.
Well, here's a true story for you. When I was at Palmer in Iowa, I was going to chiropractic school back in the 90s. I came home on break and to visit my mom, and I looked through her refrigerator, and there's a big tub of margarine. And I said, "You need to throw that away and start eating real butter." And she said, "Why?" I said, "Because that is not good for you. That's going to be that's linked to all kinds of cancers, and it's just a little bit away from being actually a plastic molecularly."
Yeah.
And she said, "Well, my real doctor, love to hear that. My real doctor told me that I should eat margarine and not butter." I'm like, "Well, the first thing you need to do is fire that doctor and find out somebody that knows what they're talking about." And a couple months later, I get this phone call. I'm back in Iowa. I get this phone call. It's my mom. She said, "You were right. I talked to these doctors. They said throw that stuff away." So sometimes it's who says it that really is going to make a difference in people's lives. What they're going to who they're going to listen to. Nowadays, we all know that margarine is not good for you. We all know that trans fats are not good for you. But in the late 90s, that alarm bell hadn't been sounded yet. And so anybody that was telling people to eat butter as opposed to margarine was they thought that they were crazy. So the message hadn't been received well yet.
Yeah, it's insane, man. Like you're talking about the margarine being one molecule away from plastic. That's what people don't understand. Like the hydrogenation process, it's like hydrogenized oils. Um, that's what it leads to, and it's kind of insane in a sense. It's because it really is it's a shelf stabilizer, right? But hydrogenated fats, trans fats, like definitely, as you just said, you definitely want to avoid those things like at all cost.
I agree. Like on the other side of the coin, if you are a industrial sized bakery, like you own Entenmann's, and you buy these types of products by the gallon, by the bucketful, you don't want to see it oxidize and spoil on the shelves. You want to keep it as long as you can to get as much use out of it before it goes bad. And that's why today that stuff is still being used in industrial baking. It's still being used with fast food. I just read that one company, Steak and Shake, was no longer going to use trans fats to fry their foods. They're going to go back to beef tallow. It's more expensive and it doesn't last as long, but they are trying to do the right thing. And I hope that other companies take note and follow suit with that.
Absolutely. At least it looks like things are going in the right direction in some aspects. So let's keep the ball rolling on that. Um, but back to fat loss. Uh, so what I see a lot, I don't know if you see this, but most people that take the approach of eat less, exercise more, which is what their doctor tells them. But that's as far as it goes, pretty much. And like over 95% of people who set out to lose weight, they fail in the long term. It's because this information, to my understanding, is incorrect at best.
Yeah, a lot of it's incomplete information. the theory about calories in versus calories out was one way of looking at things, but it doesn't take into consideration other factors such as inflammation, oxidative stress, thyroid disease, genetics, just all kinds of variables out there. And one of the things that I really need to emphasize is the part about psychology being a super important part of this campaign. So if you are under a lot of stress, or if your stress is not managed correctly, good luck with that. So, I mean, weight loss is 90% nutrition, 10% exercise. But if you're not paying attention to your brain and the psychological aspects of it, it's like pushing the ocean back with a broom.
That makes sense. Like so much of what we talk about on the show is the mind. Like the power of the mind is really undescribable. It's infinite, right? And the mind is really the foundation because it kind of indicates what decisions we're going to make. And the power of our beliefs, our values, all these things kind of integrate into who we are. And the mind being the foundation. Would you agree with that?
I would. I mean, I'm not a mental health professional, but I do appreciate the aspect and the power that the brain has on so many areas of your life. There's a concept called the mind body connection, and I do believe that there has a lot of validity to it. Again, I'm not a mental health professional, but I've seen so many examples of this in play that I think that people really should take it seriously.
100%. So if you have somebody come in, maybe for fat loss, is there a certain mindset or psychological makeup that you would kind of recommend they undertake? Or you also see like a psychology that is holding them back from making progress?
So when I'm trying to get people healthier, more so than just simple weight loss, I'm just trying to get them healthy. I focus on the basics first and foremost, making sure that they're eating correctly, they're putting good quality nutrition in their bodies, they're getting plenty of rest, plenty of sleep, they're exercising, they are managing their stress, they are just doing everything that they can to try to maximize the fundamentals as much as possible. If they have some kind of underlying issue, that has to be addressed. I'll give you an example. When you're a little child and you do something really well, like you get A's on your report card, and mommy gives you a cookie for doing well, you start to associate a reward with good grades. That reward being food, or maybe she gives you an extra piece of pie, or maybe she gives you an extra soda. So invariably, parents are teaching their kids that good behavior or a job well done is associated with foods, and specifically sweet foods or foods that may not be beneficial to one's health. And so that could be the foundation of where a lot of this could be coming from. Maybe people are eating their problems away. Maybe they're medicating themselves with food. Maybe they have stress and anxiety and they grab a thing of pretzels and a Diet Pepsi, and that's the way that they deal with that. So, and it used to be like, you'd smoke a cigarette when you get a little bit nervous. Now you would eat a Twinkie, or you would drink a soda, or you would do something like that to try to alleviate stress by putting junk in your system. And people have to think about that. They have to start to appreciate that that is not the solution to the problem. They have to figure out what they really should be focusing on. So whenever I have a problem, whenever I'm stressed out or whatever, my solution is I take my dog for a walk. I have a silver lab, and he is spoiled rotten. And so I want to take him for a 3.5 mile walk, and I come home beat, and I just put me in bed and cover me up, and he's ready to go. He thinks that's playtime. So, but that I feel better after I exercise.
Definitely, that's a good strategy, man. I mean, these neuroassociations that we carry around, like we don't realize it, and they also can be changed. So thanks for mentioning that.
Yeah.
So, lastly, why is it that we should not live in a drug first culture? Like, it's kind of like you just mentioned. It's the first thing that we go to. It's the first thing that we think of. And of course, they have their place. But ultimately, if we can do the natural things first, I always find that's the best solution.
So we do definitely live in a drug culture. We live in a culture that is governed by companies that have a ton of political and lobbying power, and they pass laws to protect themselves. So, for example, like vaccines, if you get injured with a vaccine, you cannot sue the vaccine manufacturer. They have indemnified themselves from any kind of being able to get rebuttal from it. So, for example, if you were to buy a product at Lowe's for home improvements, and you use the product and it actually injures you in the process, you have the ability to go after the company for damages as a result of using their product. If you get a vaccine, you don't have that recourse. They've made it impossible to go after the drug manufacturers. The same thing with using regular drugs that's not a vaccine. The danger is that all drugs have side effects. Every single drug out there has a lot of side effects. And so whenever you take like a drug, for example, it's been researched, it's been FDA approved, there's a lot of great data on it, and it's pretty safe to take. But what happens if you take drug one and drug two together? How much information is out there about side effects? None. Zero. So what happens when you take drug 1, 2, 3, 4, 5, 6, and 7 all together? You have no idea. The most I've ever seen in my entire career, a guy walked in with his drug list. It was a page and a half, single space typed. That's a lot of drugs. And he walked in like a zombie because of all the drugs that his well-meaning yet clueless doctors had ordered for him. Why should you avoid that? Primarily because just like there's more than one way to cook an egg, there's more than one way to fix a health problem. Drugs are one option. It's not the only option available to you. So I would encourage people watching this podcast or listening to this podcast to explore natural things that don't cause side effects and potential other problems in the process.
Absolutely. And there's like another thing called polypharmacy. Like that guy walked in with all these drugs, but I'd imagine he probably seen multiple physicians, which are not communicating to each other about the drugs that they're taking and all the side effects.
Yeah, exactly.
Insane, man. Yeah, it's like as we said, they have their place, but the more health that we can integrate with our own lives, the better. So we can just kind of stay away from the system and develop our own agency and be a life for others. That's what I find at the end of the day.
I agree. Yeah.
All right, man. So this has been awesome. I really appreciate you coming on and sharing all your insights with us. You have an amazing story. You spoke so well on the thyroid and autoimmune disease because a lot of people, we understand like we have these things, but we don't have a clear explanation of what they are. And I find that we tend to fear what we don't understand. If we have all these things in our lives and it becomes more clear, we shine the light of awareness on it, the fear kind of dissipates and it kind of leaves room for action. That's what I find, man. So again, thank you so much for coming on. And if people want to get connected with you, where can they go?
So the best way to move forward, if you have a problem and if you want to talk to me about this, I offer a free service, a discovery call. and you can book a discovery call. It's a free 5 to 10 minute conversation with me on the phone. Give me a call at 412-595-7332. That's 412-595-7332. And we can set up a discovery call, one-to-one conversation where you can tell me your story and your goals, and we'll give you an action plan after that.
Awesome, man. Thank you so much for coming on. It's been an honor.
Thank you for having me. I appreciate it. Have a good day, Anthony.